We want to welcome everyone this evening to CCR&R and the Department of Health and Human Services. As our guest from IA Navigator is here to talk a little bit about the insurance options available in Iowa. I'd like to now turn this over to Jeremy Smith.
Hey everybody, so thanks so much for having me. We started this partnership last year and we was able to do this webinar last year, and we got a lot of really great feedback, and our program was able to help a lot of folks after the webinar. So we wanted to do another one this year with some of the updates that we're seeing, and just kind of give everybody a refresher on insurance options available in Iowa. The whole process can be confusing, so we wanted to go through everything so everybody knows where to reach out for help. So our program, Iowa Navigator, we're an absolutely free grant-funded program just to help folks sign up for health coverage. So we've got a lot of expertise in helping groups find health insurance options. So this webinar can be both for somebody that owns a facility and has employees that work for them, or just if you and your family don't have health coverage and you're looking to see what kind of options you have. So first off, I'll go back just a little bit. I work for a nonprofit organization called First Choice Services, and we specialize in social service helplines. So a lot of 800 numbers that you might see that people call for help. We specialize in setting those kind of programs up and then staffing them and answering the phone. So we've grown pretty rapidly over the last several years. Even since I've been within the organization, we've grown significantly. It's a lot of really great programs. So we do a lot of lines around behavioral health. We do substance use helplines, suicide prevention lifelines, gambling addiction helplines. And then we do this Navigator program, which is a grant-funded program just to help people figure out what kind of health insurance options they have and help them with the enrollment process. We've been doing it for West Virginia since 2015. And then several years back, we was also selected to be the Navigator grantees for Iowa, Montana, and New Hampshire. So we've been able to do a lot of really great work as people try to figure out, what options they have and how you go about going through the whole process. So exactly what a Navigator is, like I said, we're free to any Iowa resident. We are grant funded, and we get our grant from the Centers for Medicare and Medicaid Services. And then we have to do annual training with them and certification. And we have to be able to look at all the different plans and options and be able to help people through that process. So we mainly help with insurance options that are available through the Health Insurance Marketplace. Those are the plans on healthcare.gov. Then we help with Medicaid enrollment and the CHIP program for kids, which a lot of folks may know that as the Hawkeye program. So like I said, we just answer questions or help somebody through that whole enrollment process and do their application for them. So anybody can reach out to us and ask questions and get help, and we'll do as little or as much as somebody might need us to do. So we was really happy. We've been doing this program in Iowa for a little over 3 years now. And we was really happy in 2021, our funding, we had to reapply for the program and reapply for our funding. And we was selected to do the work for 3 more years. And so we're actually just started year 2 of that 3-year grant. And we was able to get our funding a little bit more than double what we had been operating at. So we was able to bring on more staff, more training, and then one of the really good options that we was able to offer is we was able to hire Spanish speaking navigators as well. So we've got folks that can help out in English, Spanish, and then also we was able to use it. We've got a translation line for somebody that might need our assistance in another language other than English and Spanish. We can tap into that translation line so that we can still help folks. So if you're not familiar, the health insurance marketplace, this is like a one-stop shop for what health insurance companies are offering plans in the state of Iowa. And generally, this is for folks that can't get health insurance through a job. So if you're working somewhere and your employer offers health insurance, generally that's what you go for. This is an option for people that are not offered insurance through a job, or, and I'll be talking more about this in depth in just a little bit, but for the first time ever, if the offer of coverage from an employer is unaffordable, you can opt out of that coverage and come onto the marketplace to get your health insurance. So the insurance plans on the marketplace, there's a variety of different plans to pick from. There's bronze plans, silver plans, and gold plans. And so your bronze plans typically are the cheapest per month. It may be as little as $0 per month for you to sign up for one of these plans, but it may have a little bit higher deductible. So you may have to meet that deductible before the insurance plan kicks in and starts doing a lot of coverage for you. Your silver plans are kind of your more mid-level. The premium's still a little bit cheaper, but it's higher than your bronze plans, but then your deductibles are a little bit lower. And then your gold plans, these are going to be a little bit more per month, but your deductibles and co-pays will be cheaper. So like I mentioned, the marketplace, this is a one-stop shop for companies to come in and offer private health insurance plans, where people can look through the products and decide which plan they might want to pick. The good thing about the marketplace is any issuer that wants to offer a health insurance plan in the state of Iowa and it's placed on the marketplace, it has to be a good quality company and product that is reviewed at the state level and the federal level. So they have to be in good standing. They all have to cover at a minimum certain things. So these are our common things that we're always going to need to use for health insurance. There can't be no surprises. They have to offer all the same things. And then they have to offer a variety of different plans, and they have to have the same pricing on the marketplace versus if you just buy it directly through their company. When I was mentioning that the plans all have to cover a certain set of things, these are the things that insurance plans have to cover now to be ACA compliant. So they have to cover hospitalization, emergency rooms, baby care, mental health and addiction treatment, preventative care, prescription coverage. So they have to cover these 10 essential benefits to be considered to be sold on the marketplace in the state of Iowa. So that way you don't have to worry about any surprises. You signed up for the plan and then you find out it doesn't cover what you need. All of these plans have to cover all of these essential health benefits. Preventative care, that's another thing. So if you buy your health insurance plan on the marketplace, all of them come with free preventative care. So even if you got the cheapest plan available to you, but even if it has a high deductible, there's certain things that you can use the plan for that will be free. And we can always help you kind of figure out what's that's going to be, and make sure that you have that up-to-date list. So who's eligible for marketplace coverage? I already mentioned one thing. Generally, you have to be not able to get it from another avenue. So you can't get it through a job generally. This is for folks that can't get it on Medicare or Medicaid. And so you must also live in the United States. and you have to either be a U.S. citizen or a lawfully present immigrant in order to be able to get your insurance on the marketplace. The way that the program works is everything comes with a monthly subsidy that helps pay for the health insurance plan that you pick out. And the big technical term is called the advanced premium tax credit. And what this means is that you look on the marketplace and you pick out the health insurance plan that you want, and then you fill out an application, and based on your income and your family size, the federal government decides how much they will help you pay on the plan you picked out. And so this comes in the form of a monthly subsidy that they send directly to that insurance company that you've picked out. And then the insurance company bills you for the difference. And in most cases, for most people, the subsidy covers a huge chunk of the price of the insurance plan. And in fact, over the last couple of years, we've seen the pricing go down to the lowest levels that I've seen since I've been doing this program. So the subsidies really help pay for the insurance plan that you want. The other thing that you can qualify for if you get your insurance on the marketplace is, depending on your income, you can get plans that offer lower deductibles and copays. So if you're below 250% of the federal poverty level, you can pick out a plan that has much lower deductibles and copays than all the rest of the plans normally. The reason that we're doing this webinar tonight is we're in a really important time to pay attention for health insurance options. The annual open enrollment period for the health insurance marketplace, it's getting ready to launch next week on November 1st. So the annual open enrollment period will go from November 1st to January 15th of 2023. So if you would want the insurance as soon as possible, you have to enroll before December 15th, and then your plan will start on January 1st. If you sign up anytime between December 15th and January 15th, your plan will begin on February 1st. But really, the really important thing to remember is you have to get signed up before January 15th if you want coverage. If you miss that deadline, you may not be able to get coverage again until 2024. The only exception, if you do miss open enrollment, is if you have a life qualifying event in the middle of the year. Most common, this is if you lose the current insurance plan that you have right now. If you lose that in the middle of the year, then generally you have 60 days to go ahead and sign up for the next kind of insurance that you're looking for on the marketplace or through a job or COBRA or whatever that is. But it's just really important to make sure that you know these dates. Also, if you currently have marketplace coverage, you'll want to make sure you re-enroll. We never advocate for somebody to letting it auto renew. There's a lot of things that can go wrong with the auto renew process. So you really need to actively re-enroll every year if you have the health insurance marketplace plans. This might be the most exciting update that I have for everybody. This is just huge news. I've been a health insurance navigator since the very beginning of the program back in 2013. So we're getting ready to start our 10th annual open enrollment period, and the feds have finally made a fix to a large problem that we've always saw with this program, and it's what was called the family glitch. And so I'll try not to be too technical, and I'll explain this. All of these years, if you were married to somebody and their job offered you health insurance, that disqualified you from being able to get the marketplace coverage. No matter what the cost was, your spouse's employer could charge anything they wanted, but because they offered you the coverage, it knocked you out of being able to get a subsidized marketplace plan. So we've always called that the family glitch. And so new federal rules that just came out just this month, they have finally addressed this issue. And for the first time ever, there's going to be an affordability test. So what that means is that if your spouse offers you coverage, you can find out how much it's costing you. And if it costs more than 9.12% of your family income, you can opt out of that employer coverage, and you can be able to sign up for the marketplace with that subsidy that helps you pay for the plan. So I really estimate that thousands of families around the state will be able to qualify for marketplace coverage now that this family glitch has been fixed. So please, if you fall into this category and you get your insurance through your spouse's job, you may want to check into this and see if this is a good option. We really think that it's going to benefit a lot of families for the first time ever. And it can be a little bit complicated. So if anybody has questions on this, that's one of the things that you can reach out to us, and we will help you figure all this out so that you can get the best healthcare options available to you. The other thing that was cemented with this program this year is when the Inflation Reduction Act was passed by Congress earlier this year, it enhanced the subsidies that people can get, which basically just means that the pricing is going to stay at a lower level as it was throughout the pandemic. And they're going to be able to do that for 3 more years right now. So what that means is the pricing has gone down. Nationally, we're seeing about 4 in 5 people can get a plan for starting then less than $10 a month. So it's the lowest pricing that I've seen since I've been doing this program. So what I've been telling people is, even if you checked into the marketplace plans on healthcare.gov, in the past, it's really a good idea to come back and look at the new updates and the new plans and pricing. I really think that people will be pleasantly surprised in almost all cases. Lastly, the other major update is it used to be that if you made more than 400% of the federal poverty level, you could not qualify for subsidies for these plans. The Inflation Reduction Act also did away with that. So even higher income earners can now qualify for subsidies on the marketplace. So the carriers that we have in Iowa that offer plans on healthcare.gov, we've got Wellmark, Medica, and Oscar, and they've been around for at least a couple years, all 3 of these companies. Some of them have been around for even way longer than that. The new addition that I do not have very much information on, I just got word just yesterday that we're going to have a new carrier coming into the state called Care Source. I have very little information about this so far. I don't know if they're only going to be in certain counties or what kind of coverage they're going to be offering. But it looks like as of now, we'll have 4 carriers in Iowa. And so when you're shopping for health insurance, these are the 4 that you really need to pay attention to. Anything else at all that you may be looking at when it comes to health insurance products, there's a good chance that that may not be a ACA compliant health insurance plan. Any other companies other than these 4, it's a good chance that they may be offering what's called a short-term limited benefit plan. And the coverage is completely different. It still asks about pre-existing conditions, which these plans do not. There may be some limitations in the kind of coverage. So just be really careful where you shop for your health insurance. And healthcare.gov, that's the marketplace website. That's the ones that will have the legitimate plans. And these 4 are the marketplace carriers for Iowa.
Hi, Jeremy. We have a couple of questions, if that would be all right.
Sure.
All right, the first one says, I'm retiring and the coverage, what will be my former employer offers is very expensive.
Mhm.
Does this disqualify me from getting coverage from the marketplace?
No, so I don't believe that it will disqualify you. So we'd have to look at your exact situation, but I think that this new family glitch fix that I was just talking about, you may qualify for, you know, the marketplace insurance because the employer offer is unaffordable possibly. So what we have to do is we'd have to find out the exact cost of the plan of what the coverage would be. And then we can try to calculate if it's over or under that 9.12% of the family's annual income.
Can they call you now, or do people need to wait until November 1st?
We are definitely, our lines are open this week and we're taking a lot of appointments and we are screening people and talking to people about their situations. We're a little bit limited on what we can do until November 1st, just because the new plans is not loaded into the system yet. But that being said, yes, please go ahead and reach out to us and we'll talk to you and do what we can to get you set up with an appointment for November 1st or after.
Okay, great. Can you repeat the percentage of income in relation to the spouse's job offering insurance? I believe it was 9.1%. Is that household adjusted gross, or what is that?
Yeah, it's the marketplace uses what's called modified adjusted gross income, and it's 9.12% of the family income. And what you have to do is find out what the lowest cost plan that's going to be offered to you. You have to find out what that price is, and then we can determine if it's going to be deemed affordable or not.
Okay, thank you. And then last, it says, next question is, currently we have Medica. My husband and I both are in-home childcare providers, and the coverage is for 2 people. We pay about $380 a month for insurance. How do we get a deal for closer to the $10 price range?
Right.
I'm not interested in filling out something on Marketplace. Can we just call you? How does that work? Yeah.
So, yes, the $10 a month, that's the average of what people's paying nationally if they get their insurance on the marketplace. And that's the starting prices usually, and then they can go up from there. So everything is really, it depends on what your family size and your income is. So based on your income, that determines how much of a subsidy you get that helps pay for your health insurance plan. And so you can definitely call us and we can kind of give you those plans and prices quotes. And if you do want to go ahead and sign up and get the subsidy, yes, you do have to go through the marketplace to get the subsidy, but our folks can do that for you and get all that taken care of and get the application finished for you.
All right, thank you.
You're very welcome. So I wanted to pivot just a little bit because we do help with more than just the health insurance marketplace plans. We also help with Medicaid enrollments and the CHIP program, which is Hawkeye. And so you can see here, I won't read this to you, but you can see from the slides kind of what the income cutoffs are for Medicaid and Hawkeye. So if you and your family think that you might be under those particular categories, give us a call. We can help you figure it out, and we can help you get signed up for Medicaid or that CHIP program. It's really good coverage, and a lot of folks are really happy, especially with CHIP and kids. It's really been a game changer for a lot of families. So if you have questions on being able to sign up for that, reach out to us, and we can help through that process as well. So
Jeremy, excuse me, we have one more question.
Sure.
The question is, I live in a 2-adult household, but we are not married. Is my significant other's income counted towards my eligibility?
It's a great question. So for the health insurance marketplace purposes, they look at a household not by who lives under the same roof, but who is on the same tax form. So you would count yourself as a family of one unless you file your taxes jointly, or if you claim dependents, or if you were claimed as somebody else's dependent. So everything is based on who's on the same tax form, not just who lives under the household.
Great, thank you.
You're very welcome. And so wanted to let everybody know we have plenty of capacity right now to answer questions and assist with enrollment. Our folks, we are in Monday through Friday, 8 a.m. to 5 p.m. And so if you want to go ahead and get on our books, or if you just want to ask questions, you can reach out to us, 515-978-9570. And you'll want to definitely have an idea of what your income is, because that's what will help us figure out which program you may fall into, or what you may qualify for. You'll also need date of births and social security numbers for everybody in your family if you do indeed want to enroll. So you'll definitely want to have all that information available. And then if you're wanting to enroll in a marketplace plan, one of the things that we do is we really dig into the details of the plans, and we make sure your doctors are in network, and make sure your medicines are going to be covered with the plan you're thinking about. So it's a good idea to have a list of your medications on you, and also a list of the doctors that you want to see, or the hospital networks you want to go to. That way we can make sure that the plan you're thinking about has coverage for those facilities you want to use.
Jeremy, we have another question. I think this has to do with that adjusted income that Marketplace uses. But when somebody comes to your appointment, do they bring their net income or their gross income to your team?
It's going to be the gross income.
Okay.
Unless you're a small business owner, then you're going to look at your gross minus your deductions. And so after you've paid your business expenses, generally on there somewhere, there's a line on how much you actually earned. For business owners, that's what they're going to use. Otherwise, it's going to be your gross income is what they go off of. And so everything will be based on your projected 2023 income. And so it won't matter what you've made in the past. It's going to matter what you project to make next year in 2023.
So at this time, if people have their income taxes from 2021, which is all they have, they don't need to bring that, or they need to bring it to give you what they think they're going to make plus what their increased wages were? Or?
Yeah, I mean, basically, you have to put an estimate on the application on what you think you're going to make in 2023. In most cases, the system doesn't ask for proof of what you're putting down. What it does is it's tapped into the IRS database. And so if you're too far off on your projection, it'll show that according to their records from 2020 or 2021, that it's way different. And then in that case, they may ask for proof of why you think you're going to make what you're going to make. Otherwise, everything it goes off of what you project. And the way that the marketplace works is you put an estimate in on your application now, and then at the end of 2023, when you have to file a tax return, and the marketplace sends you what's called a 1095-A tax form. And what that does is when you file your taxes, it compares what you thought you was going to make versus what you actually ended up making. And if your projection was off, let's say that you come in, if you made more than what you thought you was going to, you may have to pay back a little bit of money to the IRS, depending on how much you was off. And if you come in and under your projection, then they're going to give you a larger refund, because that means you was paying too much for your health insurance. So they kind of settle up at the end of the year to kind of make sure everything balances out. But also in the middle of the year, if you see your projection is going one way or the other, you can always make updates in the middle of the year so that everything kind of balances out throughout the year.
Okay, we have another question. I'm turning 64 in December. I currently pay $635 a month for just myself through Wellmark. I am an in-home daycare single wage earner. Insurance is killing me. What would you suggest for me to do?
So I think it's important to, we would need to know whether you're buying directly through Wellmark or if you're going through the marketplace and selecting Wellmark and getting some sort of subsidy. That's the first thing that we need to check into. Because if you're just buying directly through the company, you're not eligible to get the government subsidy that helps you pay for it. Other than that, there are other carriers on the marketplace. It might be worthwhile to check into some of those other plans that are being offered by other companies to see if maybe they have a better rate or something that's going to be able to fit your budget a little bit better.
Okay, thank you. And then the last question is, what is the sustainability of this marketplace network if this is a grant? You indicated that you're in year 2 of a 3-year cycle, then what happens?
Yep, so we're really 2 different things. So the marketplace is, it's healthcare.gov, and that's federally controlled. And so that launched in, first launched in 2013. And it's been going ever since if that first initial launch. And in fact, they make updates to it every year and it seems to get stronger. So the marketplace itself, no signs of it going anywhere at all. Now for us, we are the Navigator grantees. And so our grant is on a 3-year cycle. And so we're in year 2 of 3, year 2 of 3 of our grant to be able to help people to provide this free assistance. And so when our grant's up, we'll definitely reapply. And at that point, hopefully we're selected again. We've been doing this for a number of years and we've been able to continue to be selected to provide this free assistance. So yeah, we'll definitely reapply and hopefully we're selected, and hopefully the feds still have the funding available so we can still provide this Navigator program.
Great, thank you. That's all the questions we have.
Okay. So just to recap, a lot of people are familiar with getting insurance through a group, and that's through your employer. So if your employer offers you health insurance, you know, that's great. In most cases, that's what you're going to go ahead and probably sign up for. But if you're getting insurance through your spouse's job, it may be worth checking into these new options on the marketplace. The other options to consider is the plans on healthcare.gov, which is what we've mainly been talking about tonight, the health insurance marketplace plans. And once again, the open enrollment for that is November 1st to January 15th. And then, of course, the other programs that we help with is the Medicaid program through the state and the CHIP program, also known as Hawkeye. So there are options to be able to get health insurance. Once again, I will warn you, be careful where you shop for health insurance. If you do a Google search, a large majority of the websites that come up and try to sell insurance plans, they're selling what's called these short-term limited benefit plans. They've also been referred to as junk plans. Like I said, they still ask about pre-existing conditions. They have a lot of exclusions built into them. But people that call and try to sell it to you, they make it sound better than it is sometimes. So just be really careful. And if you ever have questions about the type of plan that you're looking at, like I mentioned, our Navigator program is a free grant-funded program. We have to provide unbiased information. So if you want to call and check up on something that you're looking at, give us a call and we'd be glad to help you through that process. If anybody would like any of our flyers or business cards, please reach out to me. We get our grant funding based on how many people we can help. So we have capacity to help folks. We want to help folks. If you know anybody that has questions or needs assistance, please send them our way, and we're going to do whatever we can to help them through the process. But if you need those flyers or anything like that, please reach out to me. We also have a Facebook page, and nowadays that's a great way to get the word out. So if you can go to our website and find our Facebook page, please share that with organizations you work with, or parents you work with, or friends or family. Our contact information, once again, is right here. So if you want to get a hold of me through email, navigator@firstchoiceservices.org, our website, acanavigator.com. Once again, we've got the Facebook page that you can get to through acanavigator.com. And then our phone numbers, like I mentioned, we've got an English speaking option, Spanish speaking option. And then if somebody needs help in another language, we'll get translation services on the line with us as well. But you can give us a call locally, or the 800 number. Once again, locally, 515-978-9570. And like I said, we're really just here to help people. And we did this presentation last year, and a lot of folks reached out, and we was able to help a lot of families. So we want to make sure that continues. So if you all need anything, please reach out and let us know. So from there, I'll go ahead and open it up to any other questions that we have, or if anybody, Tammy or Bobby, if you have anything you want to add or have me address.
Yeah, I really appreciate all the information you provided tonight, Jeremy. The one thing I really like about Iowa Navigator, and what was also shared last year, it's a great resource, because most of us really have a challenge navigating the healthcare, and understanding plans, and those deductibles and copays. And the staff that you have at your call center can really help a person understand what their needs are, based on, like you said, their current medications, the doctors they use, and really dive in deeper into the plans to help a person understand what that best fit is based on their needs. The other thing that I really like about the services you provide is that you help people complete all the forms. You work with them online to complete all the forms, so it's not a person going out to really healthcare.org, I'm probably not saying the right one, healthcare.gov, and really kind of like searching and being confused. The navigator, kind of what they're called, really helps navigate that process. And I think it's just great even to fill out the applications and have a greater understanding of that, to help through that process. Usually, and you didn't say it, I don't think this year, about, when you're scheduling appointments and that, usually how long does an appointment take?
So the initial screening may only take 10 or 15 minutes, and that's where we're going to see what program you might qualify for, try to give you some estimates on what the plan might end up costing you. And then usually what we'll do is we'll book a follow-up appointment with you when you have time to sit down and do the whole process. And that takes, on average, about 45 minutes. It can be a little bit quicker, or sometimes it may take even up to an hour, hour and a half. But on average, you need to block off at least about 45 minutes to get through the whole enrollment process, just because, Tammy, like you mentioned, we really do want to make sure that you understand the deductibles and copays. We want to make sure your doctors are in network, your medicines are covered, go over all the different companies and all the different plans that's offered. So it can be a big undertaking, but we go through it dozens and dozens of times a day. So we can get through it with you pretty quick and make sure that you get signed up for what's going to be best for you and your family.
And then the other thing is, I believe all your staff have to go through a specific training and be certified. So it's not just
Yep.
somebody hired off the street answering your calls, right?
Right, that's absolutely correct. So the federal government, CMS, uh, they created what's called a health insurance navigator curriculum that we go through. So we have to be certified every year, and we have to recertify every year with the navigator curriculum. And it goes over everything that we need to know about navigating the systems and working with different kinds of folks, and just providing that really specialized assistance that people's going to need. So yeah, we go through that annual certification every year to be able to do this program.
Thanks, Jeremy. I don't know if some others have questions.
If you do have a question for Jeremy, you can type it in the question and answer box, and we'll make sure to get it answered for you tonight. Let's give everybody a few minutes to do that.
And Jeremy, remind us of the open enrollment period again.
Yeah, so open enrollment's kicking off November 1st, and it will go until January 15th. Anybody that wants to have the coverage by January 1st, they need to make sure they sign up before December 15th. And anybody that is currently enrolled in a health insurance marketplace plan, we're strongly advising, don't let it auto renew. Don't let it just roll over automatically. There's a lot of potential for a lot of errors to occur if you do that. So you'll need to make sure that you actively re-enroll before December 15th, so that auto renew doesn't take place. And our folks can definitely help you with the re-enrollment process, just the same as we can a brand new applicant. So, if you have marketplace coverage, or if you know somebody that does, reach out to us and we can help through that whole process just the same.
Well, Jeremy, I'm not seeing any additional questions popping up, but we do want to thank you for your time this evening and sharing all the information about Iowa Navigator and how you can help everyone get through the marketplace options that are available. And for anybody that is on this line on the webinar, I have shared the information on our social media accounts for Jeremy's contact information. So if you do get stuck and you didn't get a chance to write it down, you can head there. And we appreciate your time, Jeremy. Thank you.
Thanks, everybody.